place for politics.
Welcome back to MSNBC Live. So as tempers flare over the health care debate, some Democrats are actually choosing to forego town hall forums during the summer recess, which is supposed to be a time when a lawmaker is supposed to hear directly from their constituents. With me now live to talk about all this is Congressman Joseph Crowley. He's a Democrat from New York. In fact, from the very same district, very famous district, two interesting things.
Well, Geraldine Ferraro. 25 years ago this year, ran for Vice President of the United States on the Democratic ticket.
First woman.
And just yesterday, the first woman to ascend to the Supreme Court, was born and raised in my district in Soundview in the Bronx.
Sonia Sotomayor. Not bad, a very distinguished district. Hey, got to ask you about these town halls. Congressman Ford and I were talking earlier about them. Have you had any of this kind of drama in your district?
No.
Or what are you hearing from your colleagues?
Not to the same degree I think we're seeing elsewhere. I'm holding Congress on your corner, Congress on your supermarket, at your supermarkets, things of that nature. We're doing teleconferencing town halls, which we find very effective in terms of getting the give and take back and forth and information out to our constituents. But I am very intrigued by what's happening around the country to my colleagues and my friends. And I think the gentleman who was on before failed to really answer the question, that is, will you instruct your supporters not to disrupt and interfere with these meetings and stop these meetings? It's a time-honored tradition. It's almost a uniquely American tradition of town halls. It started in New England in the 1600s, and it's been a way in which leadership and the constituency can have a give and take and back and forth. And what really is happening right now is disservice to the country.
But I tell you what's interesting, and we were talking about during the break, and Harold, I'm curious your thoughts on this too, is that it doesn't seem like this is happening everywhere. It seems like there are certain states, maybe you'd even call them marginal districts, where there's more drama, where there's more excitement. Does that make sense?
Congressman Crowley touched on it during the break. Yeah. They're spending their time and resources efficiently. Yeah. So they figure they go to those districts where you have tough races, where Democrats won by narrow margins. As hard as it is to believe, there's many Democrats in the Congress who serve in districts that were won by John McCain in 08. Just because of the way we think.
50, right?
I think what's the numbers? Are close to 50?
Close to 50.
49. Yeah.
So they are focused, rightly so, in a lot of those areas. But I think the young fellow that was on earlier made two good points. One, that those who are from the other side, I don't like crazies on either side. I think the lefties and the righties, and I'm more of a lefty than a righty, but I think those in the far left have to be careful, and certainly those in the far right. The question then becomes, when can we talk about what's actually in the bill? Right. Which is a question I would have for Congressman Crowley. What do you tout as parts of the bill that will reform the health insurance side of health insurance? And what do you tout as that will reform or control costs as it relates to the rising costs in health care in this bill?
I call it the 3 C's. It's care, it's cost, it's choice, and it's also the other C from Queens, quality. And that's what we're talking about, and that's what we're trying to, I think, put together here. You can't see through all the clouds and all the forest.
Do you think cost is going to end up suffering the reality of politics? Do you think in order to get something done, your own Ways and Means committee as well, it's dealing with a lot of the taxation issues, how we might end up paying for this, is the reality of the politics here that cost is going to be the part of that ends up suffering?
It always has been a very difficult part of this, and that is getting rid of waste, abuse, and fraud, bending the cost curve, bringing it down enough so that we don't have to look for alternative revenues to make up for the rest of that. So we worked very diligently on the Ways and Means Committee. Talk about reading the bill, 90 hours plus of going through the bill from cover to end, really grappling with some very difficult issues on policy, not only on taxation. As Howard would know, the committee, it's all about taxes, but you don't just focus on the taxes, you focus on the meat of the bill as well. So driving the cost down, and then certainly finding ways to create the revenue to make sure that, one, that we have a better quality of care, that people are paying for this right now, see a reduction in their insurance. Right now we can't go, the status quo we can't continue.
We're definitely going to ask you to come back and talk about this more. I also want to talk about your trips to Afghanistan and Iraq, so we'll look forward to having you back the next several weeks.
Thank you. Thanks,
Congressman Joseph Crowley.
Thanks, great to see you, brother.
From New York. Straight ahead, Americans out of work. Now, despite today's better-than-expected jobs report, the White House says unemployment will, in fact, hit double digits. And later, Sonia Sotomayor's rise to the nation's highest court and what it actually means for Latino politics. Is this actually a historic tipping point? We'll talk about that straight ahead. You're watching MSNBC Live. I'm Carlos Watson.
MSNBC Live is brought to you by the Men's Warehouse.
You may have noticed how CEOs aren't guaranteeing much of anything these days. Well, I've been saying I guarantee it for years. And what I mean is you're going to be satisfied with the quality, the price, the way the clothes fit and wear. I mean, I can't guarantee how other people run their businesses, but I'm pretty good at guaranteeing how we run ours. Right now, when you buy any suit, you'll get a free dress shirt and tie. You're going to like the way you look. I guarantee it.
I've been growing algae for 35 years. Most people try to get rid of algae, and we're trying to grow it. The algae are very beautiful. They come in blue or red, golden, green. Algae could be converted into biofuels that we could someday run our cars on. And using algae to form biofuels, we're not competing with the food supply. And they absorb CO2, so they help solve the greenhouse problem as well. We're making a big commitment to finding out just how much algae can help to meet the fuel demands of the world.
Let me tell you about a very important phone call I made. When I got my Medicare card, I realized I needed an AARP Medicare supplement insurance card too.
One simple call gave me the chance to talk with a personal health insurance advisor
who answered all my questions about Medicare supplement plans.
So I could understand it all. After I called,
I was able to choose the plan that was right for me.
If you're already on or eligible for Medicare, call now to find out how an AARP Medicare Supplement Insurance Plan, insured by United Healthcare Insurance Company, helps you pay some of the 20% of your medical expenses not covered by Medicare Part B. That can save you from paying thousands of dollars out of your own pocket. These are the only Medicare Supplement Insurance Plans exclusively endorsed by AARP, a name you trust. When you call now, we'll send you this free information kit with all you need to enroll, so you can join the millions of people who've already trusted us for their Medicare supplement insurance. Plus, we'll send you this free guide to understanding Medicare.
The prices are competitive.
I can keep my own doctor and choose my own hospital.
and I don't need a referral to see a specialist.
Call now to get the free information kit. Plus, we'll include this free Medicare guide. And the advantages don't end there. You can choose from a wide range of plans that are all competitively priced, so you can find a plan that best fits your needs and budget. There are virtually no claim forms to fill out. And best of all, they're the only Medicare supplement plans endorsed by AARP.
When they told me these plans were endorsed by AARP,
I had only one thing to say.
Sign me up.
Call now, 1-800-459-1674, and let us help you choose the right plan. So call now, 1-800-459-1674, and find out about an AARP Medicare Supplement Insurance Plan. A personal health insurance advisor is waiting for your call.
Welcome back to MSNBC Live. I'm Carlos Watson. Now, the July jobs report is out, and for the first time in more than a year, the unemployment rate has actually dropped. Now, the July jobless rating is 9.4%. That's actually down slightly from June's 9.5%. But the White House said this morning that President Barack Obama still thinks the jobless rate will hit 10% later this year. Sharon O'Halloran is a political science professor at Columbia University. My co-host today, former Congressman Harold Ford Jr., also joins me. So.